and welcome to Round Robin. I'm your host, Robin McCormick, with the City of Hampton's Communications and Marketing Department. And today we're going to talk a little bit about care for our veterans, which is a very important topic. My guest is Dr. Priscilla Hankins. Welcome.
Good morning. Thank you, Robin, for having me.
Now, you are specifically in charge of the mental health care at the VA Center in Hampton.
Yes.
And I think that's a topic that's really grown more attention lately. I don't know if it's that there is more mental issues, or if it's just a little bit more accepted to seek treatment for it. Because I know, since the history of wars, there's been an impact on the people who fight them.
That's correct. And over the years, we have seen an increasing number of veterans who have been seeking health at the VA in general.
Well, we've had so many people who've been deployed and fighting wars over the past, certainly 10 years, but longer than that.
That's correct. And mental health disorders also are an important part of health care. And at any time, we see about 25% of the veterans who are seeking help will also require some type of mental health intervention.
So maybe they don't come in for that, but you all detect it, or it comes out in the course of treatment for other physical issues.
Yes, one of the avenues that the VA has been taking is a more integrated approach to treatment, so that if a veteran comes in for a health care issue, we have basic screenings that we do to assess for mental health issues as well, such as depression, post-traumatic stress disorder, and also substance abuse and suicidal thoughts.
Those have gotten a lot of attention in the national media because I don't know whether it's you're treating more or you're seeing more or some combination, but the particular deployments that people have been through, there has been a higher rate of at least suicide and some of the other effects. What is it that you see, and how do you go about treating these issues?
Well, what we have seen is, as we work to educate the public and also veterans about mental health disorders, that we are seeing more people come in seeking help. So first of all, identifying more veterans, and then once we get them in, educating them about treatment that is available, such as we have at the Hampton VA Medical Center, which encompasses a diverse set of treatment modalities that we have, to include inpatient for those veterans who are in crisis, who need immediate intervention and treatment.
That would be for something like suicidal thoughts or depression that renders them unable to function.
That is exactly correct.
Okay.
And then we have established programs, specialty treatment in the outpatient setting for depression, for substance abuse, and then we have a specialty post-traumatic stress disorder treatment team, because that is by far one of the most prevalent disorders that we see in the veteran population.
I would think it would have to be. I mean, they are there and they have, in many cases, witnessed something very close up, that they've seen people, their comrades die, they've been threatened, almost a victim themselves, or have sometimes some pretty serious injuries. Talk a little bit for me about post-traumatic stress and what that looks like. Maybe if I were to see it in somebody else, what that would be.
Okay, post-traumatic stress disorder, PTSD, is by definition an anxiety disorder. That does not really describe the disorder in its entirety, because it really is more complex. It can result, and I say can result because not everybody who's exposed to a traumatic event develops PTSD. Most people don't, but there are certain groups that are at risk. For instance, combat, sexual trauma, assault, natural disasters. Anybody who's exposed to a traumatic event would be at risk for developing it. So once someone is exposed to a trauma, if they develop PTSD, then there are clusters of symptoms that they can experience. One is re-experiencing, and what you would typically see with that would be nightmares, reliving the event through flashbacks, Sometimes people can have hallucinations where they hear or see things which sometimes will complicate the diagnosis because there are other disorders that also, can have those symptoms. So you have the re-experiencing, and then avoidance symptoms. Because a traumatic event can result in the worst experience that can happen to someone, the typical reaction is to avoid it, to avoid places, persons, things that remind them of it, trying not to think about it, trying not to talk about it. And very often when someone is experiencing those type of reliving experiences or thinking about it quite often, and a family member or friend will ask what's wrong, they will not divulge what happens because their symptoms tend to get worse the more they talk about it. So they try not to think about it.
And does that work? I know we've all had some sort of maybe minor experience where, something was bad and you try not to, and it might put off a little bit, but it doesn't ever help you heal or move forward usually.
Repressing those thoughts and feelings very often do not lead to recovery. And when we talk about treatment, which is one of the things that you had inquired about, it is to talk about what has happened. But people will also avoid treatment because you're asking them to do something that's very painful and difficult.
It must really hurt,
Yes.
to go through that again. If all you want to do is not deal with it, to be forced to deal with it. So how do you work with people maybe who know they need treatment but really don't want to go through what it takes at this point?
Well, one of the things that we have done is to, first of all, reach out to veterans to identify who may be having these symptoms, and that is through the screenings that we do, asking questions in a neutral way, but getting information so that if they do have positive screening questions, then to be able to open a dialogue about some other issues that they're having and then make a referral for them to talk to someone. Oftentimes when veterans come in, if they bring a family member, the family member has a lot to say and they are able to share a lot more information than the veteran or the person who is experiencing the symptoms, because they don't want to talk about it, and sometimes they don't have a lot of self-awareness of what's going on. So it's very helpful to get that perspective from the family, and they can give their observation of what's happening, that they're withdrawn. One of the other things about post-traumatic stress is that we see a lot of underlying depression, and so there's withdrawn behavior, there is a pulling back, and the families notice that their loved one is different than before the trauma happened.
I imagine there's a good bit of stoicism among military people and veterans, and that it is sometimes hard to ask for help or to seek treatment. Do you see that?
Absolutely. We're talking about men and women who have served in the military. They have gone to defend our nation, our country. They've faced some very difficult situations, and then when they return, many of them want to go on with their lives, and they don't want to be involved in any type of treatment that will remind them of difficult things that happened. And so that is one of the challenges we have in terms of engaging veterans to come into treatment. So one of the other things that we do in addition to the screening is we do outreach. We have teams that go out to the military bases and facilities to educate them about services that we have at the VA, to educate them about some of the post-deployment difficulties they may have, so that they will come to the VA to seek treatment once they are discharged.
So, and you are familiar with the military culture, having served yourself. What is it about this population that is different or special, or that needs a different approach maybe to, whether it's bringing them in the door or whether it's treating them once they're in?
I think one of the things is the age of the veterans that we see.
Wow.
And we have more women in the military, so we have more families who are affected by the deployments and the service. I think also another aspect is the culture of the VA, which we're working to change to basically let people know that this is not your grandfather's VA. This is a VA that is open to all veterans, young, middle-aged, female, male, single, family-oriented, and it takes a lot of effort to bring them in. It's also a different culture in terms of technology savvy, and we have been also working to appeal to veterans on that particular front also, so that they will come and engage in the VA.
Mm-hmm. Well, I mean, you do have veterans still from World War II, from Vietnam, from Korea, from the more recent wars. It is quite a span.
Absolutely. By far, the Vietnam War era veterans are still the most predominant population that we have.
Numbers-wise.
Yes. Yeah. But the OIF, or Operation Enduring Freedom, Operation Iraqi Freedom,
okay.
Yes, veteran population, which is our newest group of veterans, is the fastest growing population of veterans that we have. And we're seeing more women as well who come in. In fact, at Hampton, we have 17% of our veterans are female. And so we really have been reaching out to veterans so that we can get them engaged in treatment to meet their specific needs.
What is it? I mean, I think it's true in the civilian population as well. If you have a broken leg, you seek treatment. But if something else is broken that's a little harder maybe to pin down or define or isn't as obvious, there's a real stigma, or it's difficult to get some people to accept mental health treatment.
Yes, and I think mental health has long had a stigma, and some have referred to mental health issues and disorders as invisible wounds. Because they're not there, you can't see them outwardly, but people are in a lot of pain and they're suffering inwardly. And one of the challenges in bringing people in is they feel maybe shame and guilt that they don't have visible injuries that you can see outwardly. But once they start to realize that there is treatment, it is amazing. The recovery that we see veterans reach once they do allow themselves to open up. It takes time and patience to gain the trust of veterans, support from their families to encourage them to come in. And once we establish that trust, then we can really move forward with treatment with the veteran.
And treatment then could include, I suppose, group sessions or one-on-one or medication. I mean, there's a variety of options. There's more options that we have today for treating mental health issues. I mean, we know more about what works.
That is absolutely correct. You mentioned some of the previous wars going back even to the Civil War. I mean, we can go back even farther, that PTSD in particular has existed. But it wasn't until the Vietnam War era where really research, resources, time, interest invested to really put a name on PTSD.
Well, it was shell shock before that, maybe, or some other term.
That is correct. But since we have done research, and over the years, we have been able to determine what treatments are the most effective, and often it's a combination of different treatments. It could be individual and group with medications, but we really reach out to the veteran to identify what they will best respond to. And one of the most effective treatments is probably one of the ones that individuals will avoid is what's called prolonged exposure therapy, where you actually expose them to the trauma so that they can relive it, work through it, process it, and then move on. But that is, a person really has to be motivated to engage in that treatment.
I imagine that's very hard. But also, too, these things start to snowball. So if you avoid dealing with it, you may self-medicate, it may create substance abuse issues, and it could get a whole lot worse before someone decides to come forward.
Yes, one of the common three combinations that we see are depression, PTSD, and substance abuse. And many times, by the time a veteran has come, they have really wrestled with how to cope. And one of the ways is through self-medication and substance abuse. And so we have a number of different issues to address. And sometimes we have to address them all at one time. And we do have all of those services at the VA to address the PTSD, the substance abuse, the depression. We have a PTSD program that's affiliated with our domiciliary, which is another arm of care, which is a residential program. So
people who live, okay.
Yes, they can come in for usually about 60 days, address the PTSD, but also help them to develop other aspects in their lives, such as the psychosocial issues of homelessness or unemployment or broken families, with the goal of getting them reintegrated back into the community.
Because these things begin to compound so much.
That's exactly right.
Well, what would you say to a veteran who thinks maybe, well, I know I have some problems, but I can handle it. I'm good, I can handle it. What would you say about seeking treatment?
First of all, if the issues that they're having are impacting family, work, home, job, then that is an indication that these issues are going beyond, I'm just having some problems. And would recommend that they come and get an evaluation. That's where we start. We do
any
an evaluation.
Can do that.
They can come to the VA to get an evaluation, and they can start with their primary care provider. We also have mental health providers who are integrated with the primary care team, and they can start there. And if there is additional treatment, then they can be referred for specialty care. If someone is in crisis, which is another level, of distress, then we recommend that they come in immediately to be evaluated to determine if they need to be in the hospital or if they need to get engaged in treatment a little more urgently, but not necessarily be in the hospital. We do have a website that veterans can access, www.hampton.va.gov. We have a crisis hotline for those veterans who are feeling that they are desperate. They can call that crisis.
Yeah, at any point where you think you have it under control, and then one of those flashbacks or nightmares, begins to happen. And
yes.
Okay, so I'm sorry I interrupted. The hotline, you have that number?
We can get that number.
Okay, we'll put it
you.
up on the screen.
Okay.
That would be great.
Yes, the hotline, or we invite veterans to come to the emergency department. It's open 24/7. Someone is always there for someone to come in and be evaluated, and we take it to the next step from there.
It is so wonderful for the veterans in Hampton to have that resource so close by. And I know you serve pretty much the whole eastern half of the state and probably some of North Carolina, but that we have that resource right here and that we do have support for veterans makes it, I hope, a little easier for people to seek treatment. It's not like you have to drive somewhere else. You're not in an isolated place. You guys are right around the corner, really.
Yes, and we want the VA to be the treatment of choice for veterans. They have served, they deserve the best treatment, and we want them to come to see us. So we have the main hospital here in Hampton, but we also have 2 other facilities. We have a community-based clinic in Virginia Beach, and also one, as you mentioned, in North Carolina, in Elizabeth City, which opened recently so that we could serve those veterans who are in the rural area who maybe have stayed away from treatment, but now we have that convenience for them as well. And we have mental health services at both of those locations as well as at the Hampton VA.
Well, that's helpful, and thank you so much for coming by today. I think it's important for the veterans who've served our country to know that these resources are available and that it's not a reflection on them. There's no stigma if they come forward. It is treating any other war wound. It might be a little more complex, and it might be harder to ask for,
yes.
but it is one of the treatments that they deserve and may need after serving our country.
Yes.
Well, thank you so much, Dr. Hankins.
Thank you for having me.
And thank you for watching this episode of Round Robin.